Olivia, as we mentioned earlier, you were a COVID advisor to Vice President Pence. You wrote today on Twitter in response to the president blaming states. We're quoting here, once again, let's shift the blame to the states on the COVID vaccine distribution, just like you did with testing and PPE. Billions of money were spent on Operation Warp Speed. What is the point if Americans are still suffering? It's your incompetence and vindictiveness. I wonder, during your time in the administration, did some folks see this coming, this idea of laying it all on the states simply not working?
Absolutely. There is just no way that you would have worked in this environment knowing all of the obstacles that were being overcome along the way. And like we saw this with testing, that was a disaster. We saw this with PPE, which was a disaster, especially at the beginning, until FEMA steps in an organized manner to bring order to the chaos. I mean, that's why FEMA exists. They have a whole network. They know how to do disaster response, and we couldn't have done it without them. They have the networks in the states. But we had these conversations in the task force about health departments at states. I remember specifically people like Dr. Fauci and Dr. Birx and even Dr. Hahn, who have worked in hospitals, who are experts in this, who understand the hospital system, who have raised concerns along the way about the need to help and partner with these states and to have their backs in it. It's unfair to just drop off a load of vaccine and say over to you, and it's we're going to wash our hands on it, because that way we can blame the states and not take responsibility as the White House.
Congresswoman Shalala, this is supremely disappointing, right? There was so much hope. I was among the crew hoping that that now we were seeing the light at the end of the tunnel here. I wonder, there will be a new president in 21 days. He does take this seriously, President-elect Biden. But how quickly can he and his administration fill the holes here, right? I mean, we spoke on the air the other day, for instance, about all the weight being put, for instance, on private pharmacies like CVS chains in terms of giving this out here. I mean, how quickly can the Biden administration stand up what's needed to get these vaccines into people's arms?
Pretty quickly. And by the way, anyone that thinks there's a light at the end of the tunnel on this COVID raging disease is going in the wrong direction, because we're just at the beginning of this. The Biden administration will bring a sense of urgency. They can organize the country with that sense of urgency, and we can't be dependent just on our existing healthcare infrastructure. We're going to need additional sites for the distribution of this vaccine, and it's going to be more than just the pharmacies. It's going to be every clinic and probably independent sites set up so that we can get this vaccine into the arms of Americans as quickly as possible. But it will take major organization. We have not been good at vaccine distribution in this country. Only 45% of our people get the flu vaccine now. So this is new for us, but other countries have done it. Listen, I would call in UNICEF. They've done large-scale vaccinations in countries, much larger than we've ever done. I'd call the World Health Organization. The developing world has a lot more experience than we do in the distribution of vaccines very quickly and very accurately. But the Biden administration will bring the sense of urgency and a lot of skilled public health people with international experience.
Olivia, is that where we are? America in the year 2020, going into 2021, one of the richest countries in the world. I mean, I've seen UNICEF at work in the poorest countries in the world delivering basic health care. Does the U.S. today need that kind of help to get millions of Americans vaccinated?
Well, unfortunately, when you have had years of a leadership team in office that doesn't actually care about what's doing right for the American people, and in this previous year during a major pandemic, yeah, we are in a terrible situation right now, and it's going to take a long time for all of this to kind of pass and for us to get structures in place and bring order to this. And, we're in a really divided situation right now as a country on this pandemic. You have people still not wearing masks, and you have leadership, you have Republican leadership especially out there not wearing masks and setting terrible examples on a daily basis. And when you're countering messaging like that on top of a raging virus that's really just, raging across our country, I think we're in a very bad situation right now.
Well, Lord, let's hope we can turn it around finally. Congresswoman Shalala, Olivia Troye, thanks to both of you, and thanks to thanks for your service to this country.
Thank you.
Well, next.